Hello everyone, Dr. Dan back here with Megan. And Megan is a long-time chiropractic patient, right?
Yes.
How long ago did you start?
I started probably about 6 years ago.
And why did you start going to the chiropractor?
I started having migraines about 10 years ago, and so I was on a lot of medication and everything, and that wasn't working, so started going to chiropractors, and one of my chiropractors takes like a neurological approach with like eye gaze and things like that, so
Cool.
yeah, just all different kinds of approaches for it, so.
Absolutely. How many have you seen over the years?
3 and then now 4 with you.
And today's her first appointment with us.
Yes.
And so history that she talked a little bit about was some migraine issues, which are still present or not present?
They're still present, not as severe, but they're still there.
And have you traced the migraines back to like food sensitivity, more neck related, hormonally related?
With all the doctors I've seen and everything, we think it's more hormones, but I definitely think the neck is involved as well, so.
100%. Go ahead, look down for me. So with migraines, we can oftentimes have like a structural component, you can have a chemical component, you know, so foods are chemicals, sometimes foods can be triggers for migraines, sometimes hormonal changes, which happen to both guys and girls. Guys and girls both have hormonal changes throughout the weeks and the months. And so, you know, other symptoms like fatigue and maybe like anxiety or depression or irritability, you might notice every month that some weeks you're really happy and some weeks you're feeling a little down in the dumps. And the same is true with, you know, hormonally regulated migraines, where we can have a day or a couple days throughout the month where we might have hormonally related migraines, but always, always, always a structural component. And all we're doing here today is just kind of feeling that she's got a little bit of tension over on the left side of the mid-back and the spine, and a little bit up in the right shoulder, but not too much. Most of her tension's over here on this left side. And then we're just gonna scan down through the neck, and definitely the left side has her big, like just cervical vertebrae strain over on this left side. So we feel a big bump, and it's probably a little tender over there for her. Can you feel how your left shoulder is like a little more knotted up? Which is very atypical. If you see most of our videos, most everybody is more right side dominant, more right side neck, shoulder, irritation, inflammation, but she actually has left side. So are you left hand dominant?
No, I'm right hand dominant.
Right hand. Do you sleep like on your left shoulder a little bit?
Yes, I do.
Is like left side probably always every night?
Yeah.
So here at the office, and for today's appointment, we're going to take a musculoskeletal approach, right? A musculoskeletal approach. We're going to work on balancing out some of the left shoulder muscles, the right shoulder muscles, and focusing a little more on the myofascial release to help loosen up some of the associated soft tissue structures throughout the head, the neck, and down into the mid-back, maybe even down into the legs and the hips. Have you ever had this done to you?
They have one at their house, so they've used it on me before.
So this is just a hyper volt, it's called, and it's just a little vibration gun. It helps to loosen up some of the muscles throughout the body. Feels kind of good. It helps to improve circulation. It is one of our like pre-adjustment treatments that we do with clients, just to help loosen up some of the tight stuff that's going on up in the shoulders. Look straight down for me. And then lean your head over to the right for me. Definitely like right around here is where you're pretty super tied up. So again, with migraines, you know, and we're not taking like a super comprehensive approach today. We're just going to get her adjusted and loosen up her neck and her mid-back. But with migraines, there are a lot of different factors that come into play. Patients that come into the office and they start into a treatment plan, many times we'll start with the physical aspect, the musculoskeletal work, the adjustments, the soft tissue work to help straighten out the neck and the mid-back. And if that doesn't seem to clear up the migraines, then we might work into food sensitivity testing, hormonal testing, different functional medicine testing to figure out where other imbalances may lie at. On Megan's neck here. And definitely on this left side, she's got like C3, 4, and 5, which are kind of like your mid-cervical vertebrae. And she's got some tension built up around those vertebrae. And she can feel, do you feel like a little bit of soreness through there? Look down for me. And some of the things that happen up in the neck, you have a lot of lymph nodes up in your head, your face, and down in your neck. And so like right along the side of the spine here is where there's a big chain of lymph nodes, and yours feel wonderful. There's one or two just little baby infant swollen like lymph nodes. They're just a little congested, which sometimes happens when the neck muscles get tight, or if we're just, you know, fighting something off in the environment, cold, flu, bacteria, anything like that. But not bad whatsoever. Sometimes we'll see patients that have, you know, a congested cervical spine, or a congested lymphatic system up in the cervical spine. And we'll do some more like lymphedema drainage to help flush some of the irritation out. And then Megan can feel both shoulders move pretty good. Right shoulder moves just a little bit better than this left shoulder. Let's raise your right arm up overhead and then just head up for me. And we're going to feel that side's just a little tight. Let's see, left shoulder up. And then straighten your elbow. And shoulder down for me now. Good. Straighten your elbow again. And then this side moves pretty well also. Right side up. But this right side, I like it. Just, does it feel a little easier for you? Or is it a little tighter?
It's a little tighter, yeah.
Right here? Versus the left side? Okay. But good overhead motion in both the right and the left shoulder. But we do feel she's got a little bit over on this left side, a little bit of muscle tension that we're going to work on. Good, look down. All right, guys, so as we do with a lot of our other clients, step one is a little muscle work to the associated muscles around the neck. She feels pretty good up in her suboccipital spine. Suboccipital region is right up at the base of the skull. And a lot of times with headache patients and migraine patients, we'll have a big irritation, a kink or a strain of the upper cervical vertebrae, like the C1, the C2, and even up in the occiput, which is your CO vertebrae. And those three regions, the occiput, the C1, and the C2 vertebrae, they will get pretty restricted. So if we, and I'm just going to kind of position you in kind of bad posture, which you have pretty decent posture, slouch down a little bit and then let your head just kind of like sink forward and now look up a little bit. So if she's in a compressed position, this is a compressed position where the ears are in front of the shoulders, the spine rounds forward a little bit, and then so many people walk around with this like weight on their head. Do you see how that feels? So many people stay in this tense position as opposed to let's lift you up and chin tuck back, beautiful, just like that. The weight of the world, it weighs us down all day. Stress, you know, whether it's from work, home life, just, you know, your future and the world that we're living in now, so much stress. So many people, let's weigh you down. Sit compressed like this. And then the muscles up in the head and the neck and the throat and the mid-back, they get so tight. So super important. Take a deep breath in. As you exhale, Sit up nice and tall. Let that weight, there goes a little adjustment somewhere, but let the weight of the world just push it away from you. Push it up off your head, sit up tall, shoulders back, and decompress the neck like that. All right, kid. All right, let's go face down on the table for me.
Okay.
All right, and then just shoulder blades relax, nice and down easy. And then what we're seeing is definitely like right hip, right low back. And right leg's a little short, just a little bit of heel elevation on that right side. So when you see we can pull her left leg down nice and easy. And the right side, you see how that, and your ankle kind of, do you feel how your ankle gaps a little bit here? Mm-hmm. So you see how left side, left hip pulls down nicely? Right hip does not want to come down. So she's kind of all jammed up in her right side lower back right here. So we're going to raise your shirt up just a little bit. Okay. And then we're just going to tuck this under. We're going to do a little muscle work in your right side lower back. And then we definitely feel on this right side, like right through those lower lumbar vertebrae. Is that tender or not too bad?
A little bit.
Yeah. So you have a little bit of just imbalance in the lumbar spine. And you got a little muscle. Feel that click right in there? Mm-hmm. So she's got a little muscle tension down in the lower right side of the back of her lumbar spine. And that's going to kind of cause, so just like a millimeter or a couple millimeters of tension up here in the low back, it can really cause like this whole leg to get kind of jammed up. And long term, we can have like more sacral irritation, which you probably have a little bit of tenderness, would you say right there?
Yes.
And then definitely like left side might be a little tender, but right side, you're all jammed up in this right hip. So we're going to use the Hypervolt, the whole body, or the spot vibration gun right here in her right hip. And I just want you to focus on a deep breath in and a deep breath out. And just a nice soft inhale in through your nose. And then we'll exhale out through your nose. And vibration gun, the Hypervolt, just helps us to increase the circulation, get a little bit of blood flowing, create a little bit of movement down in the joint and the muscles. Helps to like vibrate the muscles, it loosens them up, it stimulates them neurologically. Helps to just relax some of the tension that we have. All right, good stuff. All right, now we're good with the feet, and that's pre-adjustment. So this right side was all short before. Still just a little tight. When we pull her left leg here, that side moves well. This right side is just a little stickier up in her low back. Okay, head up a little bit, like that. Mid-back adjustment. You know, when we look at her posture here, and she felt it, I thought that right off the get-go, the left shoulder was a little tighter. But we can see here like the shoulder height difference on the right side. So really her whole right side of her body is just a little tighter on the right side. And you can feel here versus like over here is a little more tender right there. And sometimes that's not visible in a seated position, but she does have a few little rib strains over on the right side, right through the mid-back. So let's clear some of this out. Take a deep breath in. Exhale out whole way for me. Whole way down. Good. One more. Deep breath in. Exhale out whole way for me. Good. Deep breath in. Exhale out whole way for me. Good. One more. There we go. Okay, man. Now shoulder down. Let's see if we can do a little bit. Right. Good. Now over on the left side. All right. Good job. Okay, let's face over to the right side up for me. Okay, and then head up towards the ceiling. Right there. And we're going to get right on her L3, 4. And down on her sacrum, roll gently right here. All right, other side. Side low back. Left side is not going to need as much, but we'll still get it to loosen up here. Head up towards the ceiling. Right there. And hand right here. Take deep breath in. Exhale out. Good. All right. Good movement out both sides, low back. We did see just visually when we did her one here. Good. Here. Left toes, or right toe, excuse me. Right foot. Good. Left foot. Good. And then I'm going to scoot you up just a little bit. Head right there. Good. Okay, right ankle. That's going to be that side's good. Okay, so something to work on at home. Your toe squeezes down. So when you lay in bed at night or you're on the couch, I want you to work on just pointing your feet down like this. Okay. Focus on your left foot point down. And then let's focus on your right foot point down. You see how that side's like a little tighter on this right side?
Yes.
Can you tell that? Mm-hmm. Left side down. Can you squeeze your left toes down? And now let's focus on the right side down. And you will probably feel how this side's a little tighter. Yes. So you have maybe an old ankle sprain or just an injury to this right ankle or something. And that's kind of part of the issue that kind of works the whole way up into the low back and up into the right side. So when you're laying in bed at night, just squeeze your toes down. Think about pointing your left foot for 5 to 10 seconds. And then squeeze your right toes and point your right foot. Okay? Mm-hmm. That's going to help us to just develop a little better symmetry and strength down here in the ankles. Okay. Cool? Yeah. All right, let's bend this knee up. All right. And what we work on here, guys, all right, we adjust every patient's knees into full flexion. Full flexion is like as far as we can flex because so much connective tissue, the patellar tendon, the quad, some of the leg muscles, they get really tight. And so many people have an issue getting into full knee flexion. So if you see some of our fitness videos, we do a lot of the rocking, the sitting down on the knees, so we can maintain that full flexion down into the knees. All right, time for the neck. The shoulders down nice and easy. And we're gonna work that left mid, actually, good. And right up high, shoulder down on the right. All right. All right, good movement. Sit up tall. Now we got a little bit in the right shoulder. Good. A little bit in the left shoulder. All right. Awesome. So shoulder adjustments, neck adjustments, mid back, low back. We found a little issue down in her right foot that she's going to start to work on. Some toe pointing and some toe stretching to help the feet out. Up in the upper body, everything feels pretty good. We got some good mid back adjustments. And yeah, that's it. Any questions for me today, Meg?
I don't think so.
Awesome.
Thank you.
Hope to see you guys soon and keep watching for more chiropractic videos.